have missing, bad, infected, broken or chipped teeth, or if you have dentures and partials which are uncomfortable, you constantly suffer with soreness, or you're unable to eat, chew, function normally. It has become a daily turmoil, and kind of your quality of life has been brought down because of these problems. We have a solution for you. Hi, I'm Dr. Anil K. Agarwal, a board-certified prosthodontist, and at Winterset Dental Care, we have been offering real solutions to real problems to real people ever since 1984. I would like to welcome you, and I would like you to meet some of my patients whose quality of life have been really improved by providing some of the treatment options which we do at Winterset Dental Care.
I came to Dr. Agarwal at Winterset because I was having denture pain. Dentists couldn't make a pair of dentures that would fit me, and they couldn't adjust them, and I was having facial pain and TMJ and headaches, and that had been going on for about 10 years. And I finally gave up and got desperate and called 1-800-DENTIST and ended up at Winterset Dental.
I was interested in implants even 20-something years ago, but I wanted the bugs worked out first before I went ahead and did anything. And because I talked to a lot of people, I had a bridge that was not comfortable for me any longer, and I had 4 implants put on that side to replace, rather than have a partial put in. I had implants put in.
You know, losing teeth and having baby teeth growing in and such, my teeth, especially in the front, were wide and spaced. And it wasn't until I believe that I'd started to see an orthodontist who determined eventually, through as well a diagnosis with Dr. Agarwal, that I was lacking adult teeth growing on the 2 outside teeth of the front 2.
I had problem with my teeth, trying to remember exactly. I went to a dentist, but I wasn't satisfied with the kind of work he did. And I think a neighbor of ours worked there, and she recommended Dr. Agarwal. And it was just strictly for, I don't know if it was for a filling or whatever. And then he suggested, when seeing me and took care of my situation, and he thought that I would have, I could get a better work done for my teeth, because my teeth were, I had a split in the middle and they were wearing out, like in the front, because I don't have too many back teeth, so I was wearing them down.
Recently went to the office. Dr. Cummings performed the extraction, and I needed a bone graft, and he did that and sewed me up. And I guess I had a tooth infection going on at the same time. After that tooth was pulled, I feel so much better. I'm a new person.
I was a complete denture wearer. I've had dentures almost my entire life. I had the implants in the lower, and then I have an upper denture.
And I had the procedure done in 2005. I had the dental implants and the smart erosion procedure.
On my top, if I may use my fingers to try to remember, I had to have a new bridge replaced. The original bridge was not good, okay? So that's like a 4-member bridge or something. And then all the remaining teeth were capped, okay? Every one of them. When I say capped, I might say that wrong. They were implants, not capped. They were implants, all right? So I got a bunch of implants up here with new bridge here. Down below, there were 2 new bridges below too. They were inferior. They're broken up. They were no good. And then I have some of my original teeth here. So what I have, and just trying to understand what Dr. Agarwal did for me, I have about, I'm going to say about maybe 10 implants, or maybe 5 to 10. I don't even know how he did it anymore. And then 3 major bridges.
I've had an upper denture since I'm 37. And I took very good care of my teeth up till that point. However, I'm just one of those with bad teeth. And these past few years, my bottom started really getting real bad, and then they would pull out a tooth, and I'd say, oh, the heck with it, I'll just go for another one. You know, just go along with it, just keep pulling out teeth. Till I had 5 or 6 teeth left in the bottom. And of course, I would talk like this all the time, and I was ashamed of the way I looked. And when Dr. Agarwal was at my hotel, that was it. I decided I'm going to do it, and I did it.
Ill-fitting denture, missing teeth or bad teeth can force you to lean towards food which is not healthy. Because healthier food requires proper chewing. In order to chew properly, you need healthy teeth or good-fitting teeth in your mouth. There is enough proof and enough recording that bad or infected teeth can take a toll on heart, lungs, make diabetes worse, and can even affect a newborn baby with premature delivery, miscarriages, or even make a failure in a transplanted organ. So it's not only about your teeth, it's about your health. So please take care of it.
And I realized that now I'm able to chew my food more than I did with the dentures. They were talking about that in the room, and I think that's what was causing my problem like that. It's not because I wasn't chewing my food enough with the dentures. And now I'm more aware that I have a better bite and I can do that. So, like I said, I feel they're almost like my teeth. It's just really great.
And I tried eating everything today. You know, all the hard stuff, and like the doctor's talking about, and that you can, you know, now you don't have to go for all those soft foods, and I mean, everything's great. And it's so amazing because having this, you know, these teeth put in yesterday, of course the bottoms don't hurt at all, but the upper denture, which I've been a denture wearer since I was 20, and the upper denture, I mean, nothing hurts. It's amazing. No sore spots.
I have always been conscious of teeth. I've always said that the least thing you can do as you get older is, you know, have a nice smile, a nice set of teeth, because I think it's good for you in the long run, and it's helpful to you as you get older. You're more confident speaking. You don't have bad breath. There's a number of pluses with that.
In my line of work, where I talk and listen to people, I'm a clinical therapist. I currently, since having the implants, feel much more confident, and I'm freer to use my personality and to be animated as appropriate, and I feel that they've helped my self-confidence.
I have confidence, and I feel more like talking, going out, smiling, laughing, and joking. I don't have that worry about the dentures will come loose.
I never smiled before. You know, if I did smile or laugh, because there are circumstances you can't help but do that, I would always cover my face. Now I just smile and keep smiling.
First of all, I feel a whole lot better, and I like the idea of having a dental implant. I have 2 dental implants already, side by side, and it was both done at the same time, and this was 13 years ago. I absolutely love it.
I'm very happy with the results. Again, I feel like almost like they're my own teeth. Well, with the dentures it wasn't, and I like the way they feel. I think they look good on me, because before my teeth were worn out, that you couldn't see too much of it when I smiled. So I sort of try not to smile too much unless I really, now I feel more confident.
This is absolutely, it's just great that you can live like a normal person where you don't have any hardships with eating or your teeth moving or anything. It actually, I feel like I'm 15 because, you know, remember when you were a child and you had those beautiful teeth? That's how I feel now. I never even think that they're not mine, because they are.
When I met Dr. Agarwal, I was a businessman who wasn't having the best business life or best career at that time. And just talking over a 2-year period with Dr. Agarwal and getting my self-confidence back to my mind and my brain, the gray cells from what was done in my mouth, my business has just compounded many times over. And I don't know if it's because of dental work or his spirituality and just talking to me over those 2 years. But today I have national recognition. I'm in the top 1% in this country, let alone 61 other countries, in what I do for a living. And I don't want to say maybe I owed all to Dr. Agarwal, but I can tell you if I had less than a handful of people to attribute my success to, of course all being attributed to God, but if there were 5 earthlings, if you will, he'd have to be one of the 5 that helped me.
Winterset is wonderful. Dr. Agarwal is a warm, friendly, kind person. Everyone on his staff is just, they're more like family to me than they are, you know, going into a doctor's office. And they make you feel welcome, and they're concerned not only about your teeth and what you're there for, but they're concerned about your life and your well-being, and it's just a warm, friendly atmosphere.
My experiences with my dental procedures were wonderful. All the doctors were good and very skillful. The staff was wonderful to me. Dr. Cunnings, who done the surgery, they were gentle, kind, and I felt very secure, and I felt that I was really cared about.
My experiences at Winterset Dental were very amazing, actually. Everybody is unbelievably friendly. You feel as if you're sitting with family.
Every time we've come for whatever it may be, cleanings or to check the, progress of, the implant and its adherence and such, nothing but, professional regard and a complete just display of integrity on behalf of a really well-together staff.
Just like Dr. Oz has a television show and Dr. Phil, well, Dr. Agarwal should have his own show, call it Dr. A, because he's really, he has his heart in dentistry and he's concerned about his patients. And I've always, even though I was going to him before I saw his commercials on television, I was teasing my wife. I said, look, here's Dr. Agarwal. We don't treat teeth, we treat people. That's one of my favorite lines. So every time I'm teasing my wife when she go back, she said, I've been to the dentist. I said, no, they treat people. See, you gotta go where they don't treat teeth.
He looked at me and tried to get them not to make teeth that look perfect, but he was doing the teeth for me, for my face, for my appearance, for the way everything is, and that I really appreciate it.
You're treated as a person. You're treated as a real person with real concerns, with the impression that Dr. Agarwal and his staff has love for the patient. They do love what they're doing, and it just makes a winning situation.
No regrets. And if I had it to do again, it would be the same thing. I would get them immediately. This time, it would not take me as long as it did the last time.
Anyone that is suffering or, sitting on the fence and not knowing what to do, oh, do it. You will never regret it.
I wish I would have done it a long time ago.
Oh, I'm very happy with my results. Extremely happy.
Well, I've been a denture wearer my whole life, and I feel like, it's time to do something that I'm really going to enjoy and feel good about.
I would recommend this procedure to anyone. Like I was telling Dr. Agarwal at one time, you can buy a Cadillac and pay for it for 3 years, and at the end of the 3 years, you don't have anything. I've had these for 25 years, and I still have them, and I'll have them till the day I die. They are worth every penny you could imaginable. And if, like I said to this woman, if anything happened to them, I would definitely tomorrow go again to have them put in because they're a lifesaver.
We should have more people, whether they're doing dentistry or selling used cars. We should have more people like Dr. Agarwal in this world. It'd be a lot better place to live.
Thank you, Dr. Agarwal.
Thank you, Dr. Agarwal.
Thank you, Dr. Agarwal.
Thank you very much, Winterset.
Thank you, Dr. Agarwal.
Thank you, Winterset.
Thank you, Dr. Agarwal.
Thank you, Dr. Agarwal.
Thank you, Dr. Agarwal. Thank you, Winterset.